Hi everyone, I am Dr. Geetha Nampiaparampil and I'm here again with my sister, Dr. Devi Nampiaparampil. She is Chief of Interventional Pain Management at the Veterans Affairs Hospital in Manhattan. Today we're going to continue our discussion on low back pain. Last time we talked about some of the common causes of low back pain, and today we're going to start talking about some of the treatments. It's important that if you have low back pain, you go see a doctor first for treatment. We're going to be providing some useful information today, but it's not a substitute for seeing your doctor. So, doctor, before we get started on the treatments, can you tell us a little bit about the natural history of low back pain?
Sure. So most people with low back pain have it resolved within approximately 1 month. The statistics are that over 50% of people have their low back pain episode resolved within that 1 month, and 90% have it resolved within 3 months. On average, we tell people that they should probably have bed rest for 3 days and then try to get back to resuming their normal activities. And the reason for that is that if they don't, they tend to get more deconditioned and it becomes more difficult for them to do those afterwards.
Sure, so resume normal activity after a few days. What about exercise?
Well, exercise can be very helpful for low back pain, but not during that acute period. So after they have rested for some time, then it's important to get back into that exercise regimen. There are a few ways that exercise can help. First of all, it can directly help with pain because it releases the body's natural endorphins, which are the body's natural painkillers. So those are released during running or other aerobic exercise. When people talk about runner's high, that's what they're talking about. Also, exercise can stretch and strengthen those muscles around the back, the spine, to strengthen them so that they can help prevent future episodes of low back pain.
Okay. So we've also heard about heating pads and ice packs for the treatment of low back pain. Can you talk a little bit about that?
Sure. The way that heating pads and ice packs work is that they distract the brain from the pain signal. Okay. So, for example, if a person, let's say, knocks into a wall or something like that, and they hit their elbow, their initial reaction will be to rub the elbow, of course.
Sure.
And the way that decreases the pain is that the person starts to feel pressure instead of pain. So they feel pressure from the rubbing, and eventually the pain goes away. Now, with heating pads and ice packs, the same thing happens. The body feels heat or it feels ice, and then it gets distracted from that pain signal, and so the person might not feel it. If there's swelling, ice can be better, but if it's not swelling, then people can feel relief from either one, heat or ice.
Okay, so that's an interesting concept, confusing the brain with these different signals. Can you give us another example of that?
For the people who have babies or small kids, they may see this a lot. So a child sometimes trips and falls, and then they look up to see what the expression is of everybody around them.
Yeah.
So what can happen is if everybody kind of goes on with what they're doing or smiles at the baby, then the baby starts to smile and laugh and play too.
Sure.
But sometimes when they look at everybody and everybody's alarmed or comes running to them, then they start to think that something bad has happened, and they become more agitated and may cry. Now, that's not the child trying to look for attention. What is happening is that the brain is trying to decide if there's something alarming or not. So if it thinks that, you know what, it's not that big a deal, for example, I feel pressure, not pain, then it tells the body, okay, let's forget about that or ignore that. But if it thinks that there is something alarming going on, then the person starts to feel more pain.
Okay. So treatments like heating pads, ice packs, they work by distracting the brain. Can you tell us a little bit about medications such as acetaminophen?
Sure. Acetaminophen works by anti-inflammatory actions is what we think now, but we don't know for sure. It's not clear. Yeah. The medication has been around for so long that now not as much research is being done to look at the mechanism of action.
Okay. And what about some other common medications?
So other anti-inflammatory medications include naproxen or ibuprofen. At low doses, they can work for pain. At higher doses, they can have an anti-inflammatory effect. So they also have effects on the rest of the body, which is why we are more concerned about bleeding, let's say, or problems with the kidney. And we always tell people to take them with food because they can affect bleeding in the GI tract, so the stomach or the intestines.
Okay. So it seems like for most people, the first few episodes of low back pain will resolve on their own. But is it worth it to take prescription opioid medication? Can you tell us a little bit about that?
Sure. So prescription opioid medications can be helpful for pain for a short time. In every patient, we have to weigh the risks and the benefits of these medications. And
Yeah.
the goals of prescribing medication have to be clear. In someone, for example, who has a job that involves a lot of lifting, maybe these medications would allow them to be able to lift for that time period, and so they can continue to work. So they may be useful in that scenario.
Okay.
In another patient, maybe if they have a lot of problems with their liver or their kidneys, maybe these medications could be useful at that time. They may be less risky than the alternatives, such as acetaminophen or ibuprofen. In other people, if they have a lot of side effects from these opioid medications, let's say sedation or drowsiness, so that they can't drive or they can't function or work, maybe they have a lot of nausea interfering with their function, then the risks can be greater than the benefits, and they may not be as appropriate of a treatment.
Okay. It's a very controversial topic, as you know. It's been in the news, the use of prescription opioids, and the rise of substance abuse, or at least our knowledge of it. Can you talk a little bit about that and your opinions on that for the use of low back pain?
Well, so for acute episodes of low back pain, of course we want people to have treatment, whether they have a history of substance abuse or not. But of course the risks of having a recurrent substance abuse problem related to the prescription opioids are higher if you take them. So it really has to be looked at on a case-by-case basis, again, weighing the risks and weighing the benefits for the particular person. In patients who have a history of problems with prescription drugs or with substance abuse, then those choices may be a little bit more risky than others, and so the risks may outweigh the benefits. Maybe a different treatment is more appropriate.
Okay, all right. So this was good. Thank you for the information with the introduction of treatment for low back pain. Tune in for our next segment. Next time we will be talking more about treatments for low back pain that are chronic in nature and more severe. Thanks.